I'm Kevin Motz. I'm one of the assistant professors of otolaryngology, head and neck surgery here at Johns Hopkins. I'm a laryngologist and a reconstructive airway surgeon. I also serve as director for the Center for Sleep Surgery here at Hopkins. I have a background and fellowship training in both laryngology as well as sleep medicine. My clinical practice focuses on the surgical management of obstructive sleep apnea for patients who are intolerant of continuous positive airway pressure, or CPAP. Additionally, my clinical focus also involves management of disorders of the larynx as well as the proximal trachea, including subglottic stenosis. My research interests include investigating immunologic mechanisms for the development of fibrosis or stenosis in the airway in patients that have been intubated for critical illness. Additionally, I have an interest in determining physiologic metrics of the upper airway for patients with sleep apnea to try to find tailored approaches to delivering novel therapies for those patients. I've always been fascinated with the airway and its impact on patients' day-to-day living and quality of life. I feel very fortunate to be able to marry two specialties, sleep medicine as well as laryngology, to really provide a unique perspective for patients so that their underlying disease processes, whether it be obstructive sleep apnea or laryngotracheal stenosis, can be better managed through a unique perspective and a different lens on the physiology as well as the biology of their disease. I really believe that excellent patient care is centered on a strong foundation of communication and trust between the patient and their doctor. I think that that's probably one of the most special things that I get to do on a day-to-day basis, is connect with individuals that are in need in some way to try to improve their health or improve their quality of life. And I think as a physician, I never take that for granted, and it's really what keeps me coming back to work every day and keeps me pushing forward on my research front to try to really move the needle and make things better. Growing up in the state of Maryland, I've always taken great pride in the healthcare systems we have here at Johns Hopkins, and have always dreamed of being a part of this. And I feel very blessed to be here, that I can continue to provide the care that I know that my family members received when I was younger to the next generation of patients.